Namaste, hello and good evening everyone. Welcome to the second day of the MeHeLP Dissemination Conference Pan-India segment. Topic for today's first session is Creative and Participatory Methodologies. To chair this session, let me invite Professor Asha Banu Soletti from the Tata Institute of Social Sciences, Mumbai. Dr. Asha is currently professor at the Center for Health and Mental Health, School of Social Work, Tata Institute of Social Sciences, Mumbai. She is also the Dean, Students Affairs, Tata Institute of Social Sciences, Mumbai. She is also a co-investigator for our project. Welcome to the
Good afternoon and good evening to all the panelists and the attendees. Today we are starting with this particular session on creative and participatory methodologies. And as we had a participating and engaging group yesterday, we anticipate the same today and welcome you all to this interesting panel. So while we are waiting for the panelists to join, here are some housekeeping announcements. I think already you are in the lobby and you're viewing the lobby and you're seeing our short films and the digital stories put up there. And also, please go to the mental health literacy questionnaires and fill the questionnaire. It's important to the research team. And with this housekeeping announcement, I would start inviting one by one today the speakers of the panel. Andy Barrett, Professor Michael Wilson, Chandradasan, and the research team Sanjana Kumar, Aarcha, and Anagha. So happy to see you all here and welcome you to the panel. And after the Pan Kerala, we are meeting our Pan India attendees today. So number of participants are different from the team of participants we have met last week. So I would go ahead and introduce the first speaker, an important player in the project, Mr. Andy Barrett. He's the artistic director of Excavate, a community theatre company in UK, and he's also an important team member of our MeHeLP project. Andy, over the years, has written many company shows and has co-directed the majority of them. His BBC series, Lily's Years, was the winner of a Sony Award, and there was one other series, Allotment, which was shortlisted for the Amnesty International Award at the Edinburgh Festival in 2006. He has worked as a mentor for a number of community-based performers and companies, and that's his strength. And in India, he's worked with 2 community-based projects, that one, MeHeLP, with our team. And before this, he was working intensively in Bastis in Pune to understand mental health resilience in migrant communities. And he has a knack to connect with people and local culture and his unique strength. And welcome Andy to start his presentation now. And to all the speakers, we are adhering to the same norms that we have 10 minutes for each speaker. And towards the end, we have Q&A for all the panelists. Over to you, Andy.
Thank you very much, Asha. I'm going to share my screen. Bear with me while I hope this works. So, can you see my screen? I hope you can, everybody. Hello. No. Right. Okay. I will go back. Entire screen. If not, I will talk without it. So is that happening now?
No.
Okay, never mind. Let me just talk to you. It doesn't really matter our images. Excellent. So, hello everyone. My name is Andy Barrett. It's great to be here. It's a shame we can't be actually with you in India. I want to start by talking. The title for the funding application for the project was Mental Health Literacy in Urban and Rural Communities in India, an interdisciplinary approach using applied theatre methodology. Now, as you can see, that places a real importance on applied theatre methodology. So first of all, what is that? What do we mean when we use the term applied theatre? Why do we want to bring that subject to, or that methodology to the subject of mental health literacy, and how did we set about it? Now, the term applied theatre is one of those that I think is not readily used in India, and in many other global contexts. But it's one that has emerged over the last 20 years in various parts of the world. And it's been described by Tim Prentke, and this is a useful description, as a broad set of theatrical practices and creative processes that take participants and audiences beyond the scope of conventional mainstream theatre into a realm of theatre that is responsive to ordinary people and their stories, local settings and priorities. So that's really important to bear in mind. And at its heart, there are some key principles, and that's around purpose. It's a theatre that is not just there to entertain. Around ideas of change. It's a theatre that seeks to create individual and social change, and contexts, very importantly. It's a theatre that it's aware of, it's responsive to, and it works with the context in which it's created and in which it's being performed. So fundamentally, it's asking questions about the telling of stories. Now, Mike will talk more about this in a moment, but it's key. And it's based on a series of incredibly important questions about power and politics and identity and culture, all of which impact on people's mental health. And luckily, I have the questions written down. They're not just on my slides, so I can read them out to you. But the questions are, who has the power to tell stories? Who doesn't have the power to tell stories? What happens to people when they're not allowed to tell their stories? How can we understand other people if we don't know their stories? How can we move forward as a community or as a society if we have no space where our stories can be shared? What happens to people when their stories are heard, when they are given a voice, and how can we learn without listening? And because of this, and because of the purposes that I said that underlie applied theatre, it's a highly participative art form. It's always looking to find ways to involve people in the creation of the work, not just as audience members that are watching something that an outsider has created, but as co-producers, as people who may have helped to research, to shape, and to produce the work that is being made. And fundamentally, it's a belief in people being able to tell their own stories to themselves, but with the help of outside practitioners, which is where the applied theatre comes in. So it's like a dialogue. It's a sharing between insiders and outsiders. It's kind of like a barter between local primary knowledge and lived experience and the skills and the knowledge and the practices of a range of theatre processes. So it's about co-construction of people coming together to create work, and that can house within it new knowledge. It's, as I said, it's not just about bringing in an external message created by experts into a community for them to respond to, but by actually making work together, it creates new forms of language, new understandings, new knowledge. So that's why we brought this to this process. And it was a challenge because we were working with a very wide geographical area in a topic that has a very clear hierarchy of knowledge. You've got patients at one end and doctors at the other end, and all the other intervening levels of kind of engagement. So breaking down those hierarchies of knowledge was a challenge. And also, however much medical people say they want to use theatre as a research tool, very often they mean that they want to use it as a form of message giving. You know, theatre is a useful tool to gather stories and to convey messages, but using tool as a research language is another challenge altogether. And the theatre people on this project were very clear from the beginning. We're not just here as message boys and errand boys for you. We want to make sure that you understand theatre, because we're going to have to learn about mental health literacy. You need to learn about theatre. So from the very beginning, when the researchers were out in the clinics to identify people to speak to, we said to them, can you really keep an ear open for metaphors, for the way that people are describing things? Maybe there are other artifacts that they have around them that help give you other forms of communication rather than just kind of written question and answer form. So we're already beginning to ask them to work in the kind of ways that theatre makers would work if they were interviewing and talking to people. And also we sent out the theatre makers to investigate the context of the work, the context of the clinics, the kind of rituals that were happening there, the physical spaces that were available, the kind of things that people in those clinics did, the kind of skills that people in those clinics might have that could potentially contribute to a performance, so that those contexts would inform the shape, the making of the piece. So in a way, the co-construction at that point was double-edged. We were asking the researchers to think about theatrical language. So theatre was a kind of a language of research, and we were also using the clinics and the context of the clinics to help us think about what kind of plays we might make. Now, Chandra will talk about that more later, but just to say what was absolutely fundamental was that it was about positioning the clinic users, as I said, not as recipients of a message, but as experts, people that have lived experience and lived knowledge that we wanted to understand from. So we had to create a structure and an idea for a play that allowed that to happen. And what that meant was the play could not be completed in some way without their input and help. So that's fundamental. The audience actually had to participate in constructing the meaning of the play. And what that did, really interestingly, was that meant that as individuals, they would make suggestions to help the play progress. But by doing that, they were revealing themselves amongst other audience members as a community with shared knowledge and shared experience and shared wisdom, which would help them to feel perhaps less alone in their own journeys, and in doing so might aid their own resilience and recovery. So it actually became like an intervention. The third thing that we planned to do, but unfortunately we couldn't, was to then take that to make a play that would be open to the wider community. And at that point, it was probably inevitable that it would have been more of a message-giving piece. It would have taken the information that we had learned and shared it back to the community. But one of the things we wanted to do, we talked about doing, but were unable to do because of COVID, was potentially using people that we had met on our travels in the clinics to actually contribute to the performance of the play in some way, to actually co-create, co-produce by being performers in some way. They may not have been main performers, but the event, which would have included the play, could have included them in some form. So they would have been part of sharing their story. That wasn't able to happen. As a result of that, instead, we ended up making a series of films. Now, obviously, that became a more difficult thing to kind of tie co-production and co-creation into, because we were distant from the communities we were working with. And it really became much more about filmmakers and researchers interrogating and working together. But what I would say is that in working through looking through the narratives to create a series of kind of draft story outlines that I did, and then various directors worked on, it was absolutely based on looking at the metaphors that were buried within the work, within the interviews that we had from the researchers interviews with clinic users and their families and the different clinic staff. So it was absolutely keying into that material, and again digging out those kind of metaphors which can do so much work. There was one thing I forgot to mention, and I will mention it before I finish, and that was I had a slide that had two words, and one word is effect and one word is affect. And effect and affect are really helpful words to think about when you think of using theatre as a tool for this kind of work. Effect, you could think about how effective has this been in passing out a message? How effective has this been in gathering a certain amount of people? It's kind of almost like a quantitative form of evaluation. Affect is different. And we have to remember that theatre is essential, passionate language. Theatre is something to be enjoyed, for the senses to revel in. It's not a dry passing of a message. And for theatre to work in any form, you have to believe in and trust its effective power, which may therefore create forms of it may pass on information and explore things in ways that are difficult to pin down in words. And it's a more qualitative form. And in a way, that's what makes it a difficult research language, because it can be quite messy and difficult to pin down. What is it exactly that's going on here? So that's why it's an interesting form as well, because it does have the potential within it to convey things in totally different ways that we might do just by conversing through language, either in the spoken form or in the written form. So just to end, I'd say that probably in terms of the idea of co-creation and co-production, the key method through which applied theatre has become that is that the mental health literacy discussions that we want to promote and that we want to encourage ultimately are being instigated by theatre performances, by digital stories, and by short films. Obviously, there are other discussions happening through things like this conference, and there'll be academic papers. But for the work to have real impact amongst the public at large, ultimately, what we are relying on is the power of story and the expertise of those who work with the tools and the language and the performance of story. So thank you very much for that.
Thank you, Andy, because we saw the performances, we saw the short films, and you have explained what are the varied processes and challenges. And I like the word power, and who has the power to narrate stories. We will come back to that. I would introduce the second speaker, Michael Wilson. Professor Michael joined Loughborough in September 2014 as Professor of Drama, and after a period of Associate Dean for Research and Dean in the School of the Arts, English and Drama. He is also Head of Creative Arts in the School of Design and Creative Arts. He is a member of the Program Advisory Boards for the Research Council UK's Program on the Digital Economy and the Arts and Humanities Research Council programs on digital transformations and connected communities. He is also a member of the HRC Strategic Reviewers Group and chaired the British Council's Arts and Humanities panel for the Researchers' Links and Institutional Links program. Professor Wilson's main research interests lie in the field of popular and vernacular performance, and he has published extensively on storytelling and its social and policy implications. So over to you, Professor Mike.
Thank you very much. It's good to be here. I think somebody got their microphone on. Might be worth checking that you're muted. Lovely to be here with you by the wonders of technology, although as echoing Andy, it'd be even nicer if we were able to be with you in India, but it's not to be, and I'm delighted to have a chance to have a quick chat with you today and to talk a little bit about storytelling, building on a lot of what Andy has just said. I was asked to speak around applied theatre methodology and storytelling approaches for research methods. And I'm going to focus primarily on storytelling, largely because Andy has spoken already very eloquently, specifically about about theatre. And the work that we do at the Storytelling Academy in Loughborough is, as Andy was talking about applied theatre, we talk about applied storytelling. So we're very interested in the way that we can use storytelling to make real differences and bring new voices to bear on the public discourse around some of the key challenges that we face in society. And of course, one of the areas that we're very active within is within health, and specifically around mental health and mental health literacy. Hence our involvement in the MeHeLP project, where we've been doing a lot of the work around the digital storytelling part of the project, but also contributing to the theatre work as well. So a few things about story, and this is going to be very difficult to limit to 10 minutes because, of course, story is one of those ubiquitous things that is around us in every aspect of our life. And story exists in many different ways. We tell stories in many different ways. We tell stories through theatre, through conversation, through film, through music, through dance, through writing. So many different ways we tell stories. And storytelling has many functions, has many purposes in society. And I certainly don't have time in 10 minutes to go through the whole myriad of purposes that storytelling has, because I think of storytelling a bit like one of those multi-function tools, like a huge Swiss Army knife with lots and lots of different blades to it. And I'm going to get a chance to talk very briefly about maybe one or two of those particular tools on this multi-function tool. So what does story do? Well, I think one of the things I wanted to mention here is that storytelling is a tool that allows us as human beings to process experience. So what I mean by that is, if something happens to me and I then go and tell you the story of that, in telling you that story, I'm processing that experience. But by processing it, I'm trying to make sense of it and I'm trying to understand it. So in that sense, storytelling is part of a sense and meaning making process. And that, of course, enables us to learn from experience, to apply that learning to future experiences. And it allows us ultimately to operate socially and to navigate our way through a very complex and sometimes challenging world. It allows us ultimately to use experience as a platform to live our lives. The second thing I wanted to mention about storytelling is that its importance in terms of building empathy. Storytelling is itself an empathetic space. It allows us or enables us to build empathetic relationships with one another. In a sense, how can we empathize with somebody until we know their story? How can we get to know them until we learn their story? And turning that the other way round, hearing somebody's story automatically kind of releases an empathetic response in some way from the listener. Because when you tell someone a personal story, the listener automatically finds connections in that story. If you tell me a story about something that happened to you, all the time I'm thinking, yes, something similar happened to me. Yeah, I remember that. Yes, I understand that. And in doing that, your story then becomes my story too. So by telling somebody a story, what you're doing is turning the personal into the collective. What begins as your personal story suddenly becomes about the collective community experience. It's what the American psychologist Jerome Bruner talked about, the transformation of private trouble into public plight. So it's around building communities through story, and that is an empathetic relationship. The third thing I wanted to mention was the importance of storytelling to introduce new voices into the public discourse, into conversations. And Andy, of course, quite rightly talked about the hierarchies of knowledge that exist in certain situations. And that means that when those hierarchies of knowledge play out, the kinds of knowledge that are at the bottom of those hierarchies can often be excluded. And that happens quite commonly within medical contexts, because the highest at the top of that hierarchy is, of course, medical knowledge, the scientific knowledge, the academic knowledge. And experiential knowledge, the narrative knowledge, often sits at the bottom of that hierarchy. And so what storytelling can do, because storytelling is something that we all do, we might not all have access to medical knowledge, but we all have access to stories. We all have access to our own experiences. And as Andy says, we're all experts in our own lives in that way. So that's our own expertise that we can bring to the table. So by using storytelling, we can start to bring in some of the voices that are either unheard or they're less prominent, shall we say, within those discussions. So we're trying to kind of even up the discursive space and make it easier for multiple voices and diverse voices to get themselves heard. Because storytelling is itself a kind of knowledge. It's a knowledge system. Storytelling is a way of knowing about the world, but is also a way of thinking about the world as well. It's through stories that we test out ideas. It's through stories that we experiment with ideas, that we make proposals which might then be challenged by the people who hear our story, and we reformulate our ideas. So it is in itself a constantly moving discursive space, a way in which we think about ideas. So we're talking here about thinking in stories and also thinking with stories. And it's a very different way of thinking than other kinds of knowledge. And that's very important for the work that we do. Now, what I'm not arguing is that storytelling or the arts itself should be at the centre of this. I'm not saying that any kind of knowledge should be at the centre. In fact, if anything, I'm arguing against the very idea of the centre. Because as soon as we talk about centres, then we're also talking about power, which is another idea that Andy very correctly alluded to, I think. And what we're trying to do is get away from the idea of who has the power, or actually that power resides in one person or one set of people at any particular time. When we're talking about knowledge, we can, and this is going to be quite a crude model, but we might, for instance, say that we could think of knowledge producers. So those are the people like the researchers and the academics and the medics who produce the knowledge. And we also then might think of another group, the knowledge implementers. So the people who take that knowledge and then apply it in a professional context. Again, sometimes the medics or nurses or carers or whatever. And then the knowledge consumers, which are usually in this context, we're talking about the service users, the patients or whatever. And what we're trying to do here is to introduce a degree of mobility in those particular roles, so that through storytelling, the knowledge consumers can also become knowledge producers, and knowledge producers can also become knowledge consumers. They can learn from the knowledge produced by other people in those relationships. So we're trying to democratize this space a little bit. So just to conclude, I can just see I'm just about running out of time in my 10 minutes. What storytelling and theatre and film and the digital stories, what they do is offer us the opportunity to open up these roles, make them more mobile, but ultimately to make knowledge production a more collaborative approach, and therefore we can develop more collaborative and participatory approaches to mental health. And then hopefully that will mean a more nuanced and sophisticated and more joined up policy around mental health literacy. That's our aim anyway, and that's why I think storytelling has an important role to play in that. Thank you very much.
Thank you, Professor Michael Wilson. And we will move on to the next speaker, Mr. Chandradasan. He is the founder of Lokadharmi Theatre Group and Maravillu, a children's theatre group, both based in Kochi, Kerala. He is the director, board member of Regional Resources Center of National School of Drama, Bangalore. He was a professor in chemistry before coming to the theatre stream at St. Albert's College, Ernakulam. Over the years, he has directed over 30 plays in Malayalam, English, Sanskrit, Kannada, Finnish, and Tamil. Chandradasan has won National Award for the Best Play at Mahindra Theatre Festival for his play Karnabaram, New Delhi in 2008. So, over to you, Mr. Chandradasan.
Thank you, Asha. It's nice to meet you, Mike, Auntie, Sanjana, and all those people. At least to this. No, as I understand, this is one of the concluding procedures of the MeHeLP project itself, and we are trying to look back into the work we are doing under this project. And I am to speak about in 10 minutes about my creative and participatory involvement in the project. As Auntie rightly pointed out, we have been using theater in different contexts as a tool of research on mental health literacy. So this was the thing. And honestly, when I'm going to speak, since I cannot see who are hearing me and what do you understand by theater, or what's your background about the whole work, I am half mutilated, means I don't know how to progress, but I'll very briefly try to explain. And I would love to carry from where Andy stopped. So from his talk, Andy had used some 4 or 5 different important words which I think. One is that the whole practice of applied theater, and especially in this case, is based on the context. The context becomes very important. When are you doing it? Why are you doing it? For whom are you doing it? And what is the whole purpose of doing it? And applied theatre has been everywhere in India, even for the 40, 50 years in different contexts, like theatre in education, theatre being used to teach chemistry, mathematics. We have courses for that, all those things, etc. And there are projects about health issues, like and there are projects. Theatre has been used to spread the literacy issues, to enhance literacy projects. So many projects have been done by the government and the quasi-government organizations in that. But using theatre in mental health research is the first thing that's happening in this project. That's what I think. Because theatre has been used mostly, when we understand theatre, we speak about a form where actors come in as characters on stages and perform as characters to educate or to entertain, to educate and entertain. And sometimes, so that's the thing which we suddenly understand. And here, the whole project is not to educate us, and is suggested. It is not to give messages. It is not to give any specific, you do this, you don't do this, this is it, like that, this is not like that, this is right, this is wrong. So we are not judging or imposing or giving messages or statements, because even in mental health literacy, we are not sure which is right and which is wrong. There are different arguments, different viewpoints, and as time changes, things are also changing, perspectives are also changing, and as context changes, it's happening. So it means that the context and the time is very important. And then it is used as a tool for research. As a tool for research, how can theater become a research tool, and how can theater be used as a research methodology, as part of theater methodology. And the usual research methodologies being mental health issue sciences, science, arts. See, the research methodologies are having a specific kind of root system, uh, a way of doing it. But the theater methodology is totally not in tune with that. So theater has its own different methodology, and research has it's a different methodology. So how to bridge it, how to connect it was the first question which we were addressing. So me, Auntie, and to my actors who are part of this project was to educate first. As Andy suggested, we are not from mental health knowledge. We just know something from literature, from observing life, by having somebody close to us having these troubles, etc., or some doctor friends. But we are not experts about that. And these research fellows, they are not, they know theater, they have some passion for theater, they have read something, they've seen something, but they do not know the intricate language of theater and the process of theater. So how to work together was the first question. How to work together with the researchers and the theater people. How to connect the methodology of research into the methodology of theater was the first thing. And the second one is that how to connect with our purpose, the purpose of knowing more about the mental health literacy aspect of it. One thing which we are sure is that this is not done as a therapeutic technique. This was not part of theater therapy. We are not trying to do therapy or to treat or to make the problem less on the challenged persons, on patients, or who, whatever time you can use. So we are not trying to treat them. So we are not giving anything like that. So that is one thing which, so it is not part of a therapy. At times it might have helped the therapeutic process. There were some telephone calls, etc., back to me after that. No, after seeing the play, some people are feeling better. They're taking medicines. They are doing that. They are doing this, etc. But that was not the purpose and main aim of the thing. So what exactly then it was? It was to dig into the current scenario of mental health issues, not just in the patient, the people who are suffering it, but also among the people, the doctors, the caretakers, and the larger society. So it may be the different kinds of mental health issues like psychosis or depression or this or that, plus the other issues like stigma, treatment, availability of treatment, need for treatment, care, the general life, social life, personal life, all these things are there. So, in that larger context, to get deeper into the nuances of the existing situation, it may give us some ideas about the literacy situation about the mental health. And we ourselves know that even the literacy term itself is fluctuating. The idea about the mental health literacy in the 60s is totally different from the idea in the 80s. Now, in 2020, we have a totally different idea about even mental health experts or psychologists or psychiatrists. All these people are changing their positions. How the system works, how the physics and chemistry of the body works with the dynamics of the mind. How does these things? And he put another four important terms, which underlines this specific situation. It is a power, politics, identity, and culture. So these four terms, which Andy very fastly suggested, become the milestones of understanding this case. So the power. Power means what is the social power? For example, we I'm not going to read into the mental health situation or the awareness, etc. But we had performances and work in urban centers, rural centers, and tribal centers. We felt that no, we speak about a lot of say the stigma, social stigma, accepting somebody who had a mental health treatment back into the social structure and care to be given to that person. Sometimes society is so blind and timid to to deal with this kind of people. We may think that no, it's more education, literacy, job, financial safety, the power. All these things will be adding up to the this kind of coming down as a stigma. But I found it the opposite. I found that the stigma is much more in the urban places, and the complex in the people itself is much more when they are in the urban city and urban places. When we went to the tribal places like Attapadi, I found that the people around the society was more caring them. They were caring them and see that these people are taken care of. Their food is given. They are not. They are at least in a safe condition. They may not be knowing the whole scientific way of going to the hospital and doing this and that, etc. That kind of knowledge may not be there, but the care, the human situation which they are doing. So it is not connected to what I was trying to say, that all these issues are not connected to the so-called power or the financial statement or the educational awareness, the general literacy, etc. It depends upon the society also, the social system also. So what is the social system with which you live with a mentally challenged person? And how does the politics is not just politics, it's the power politics that is deciding and deciding a lot of issues in human beings, in ordinary human beings. How does it plays into, and how the identity of a person or a place is also important. And these are the realities. So one thing which our aim was to facilitate this kind of dialogue, to go deeper into this kind of situation, reality. And theater has that ability to do that, because theater speaks in human terms. Theater speaks directly from mind to the mind. It's not an intellectual academic exercise. Theater is not an academic intellectual exercise. It's a very human, very passionate kind of experience with which the connection can be very easily. See, there was a question in the question answer, means in the chat box, when Mike was speaking. Somebody asked, when he was suggesting about storytelling, suppose what if somebody is not ready to speak his own story? What somebody is not, when you're asking somebody to tell his story for a research purpose, what if he doesn't tell the story? That's a question. And what about the story? Suppose he told a story. Was the story really truthful? Was it completely honest? Did he reveal the whole things, whole details? Or has he covered a little? Was he filtering it, censoring it? Said that, no, okay, now it's the real storytelling, the sharing happens only after that confidence is being built between these two people, of means the persons involved in dialogue. But theater has the power and potential to break the barrier and go directly. And within minute, you can have that thing. And there, this term participatory methodology came as important. So it becomes a participatory thing. We were not, me, Auntie, and our actors were not performing to entertain or educate. We are just initializing a dialogue. We are just creating a space where a participatory engagement, involvement can take place, where people can come up and speak their stories. They will open their heart, open their mind, and they'll start thinking themselves in a more detailed and more exact kind of situation. So what we did, that we did not, we decided two things, that no, we are not going to make drama out of a mental case study. We have looked into a lot of stories which have been told and collected by Sanjana and her group of this wonderful research fellows and those people. We read all those. And they talked back about their experience of dealing with this patient, means these people. And we have talked with the doctors. All these things were there. And we have big brainstorming discussions in the meetings where Asha and all these people we are together and discussing and discussing and discussing. And all these things helped us to reach into a kind of participatory methodology. We did not want to make melodrama out of it. We don't want to trivialize situations. We don't want to simplify situations. So we didn't trivialize situations. We went ahead with a kind of participatory technology, which theater, the new theater is speaking about this inclusive theater, where the space is inclusive. There is no different space for the actor and the audience. The actor and the audience are the same. So everybody are participants. We are not performing. Everybody has to perform as if we are in a ritual. In a ritual, in a ritual, there is no, everybody has their own role. So we invited them to participate and share the memory. We were addressing not the story, but the memory of the people, the collective memory and the individual memory of someone, of some situation, of the life, of the culture, of the past, of the context where we are performing. So we had strategies which addressed differently to different people, different situations, evolved a kind of a form which could initiate, which could share the space, the stories, food, songs, culture, and a broader kind of, we are trying to communicate with human passion so that the dialogue was much more easy, and the dialogue resulted in actual dialogue where this audience or the people who have been coming up came with their stories and they started talking back. And we were just starting, the actors went back and started hearing them, so they were performing, they were telling the stories, they were asking questions, they were giving answers, and we went back, and towards the end we came back and completed the kind of performance. So we devised a kind of theater, applied theater, which is participatory, which is creative, which is highly human, with a totally different research, different methodology than the academic research methodology. So that's what very vaguely I could present it. It's very clear to me and the Sanjana, because we have seen this thing happening, but I don't know how the other people who have not seen or tasted the process know about it. So I just conclude like this.
Thank you. Thank you so much, Dr. Chandradasan. Listening to all the three of you, there are three questions that's there in my head. But before moving to the Q&A, I will invite our interdisciplinary research team, global health dentistry expert Dr. Sanjana Kumar, and MPhil psychiatric social worker Aarcha Gowri, and also a political scientist, a budding political scientist, Anagha CR, to share their experiences from the field. Over to you, Sanjana.
Thank you, ma'am. Let me just share these slides. Is it, can you see it?
Yes, yes, it's happening, Sanjana.
Is it fine now?
Yeah.
Yeah, sure.
It's working.
Thank you so much, ma'am. Thank you so much, ma'am, for that. And thank you, theatre experts, for those wonderful talks. And so as they already spoke, they spoke about the power of theatre. And they spoke about how theatre can facilitate dialogue and the power of stories. So what I'm going to do, and the rest of our team, we're going to talk about how the research process, how the research team worked with the theatre team, and how we created these very wonderful pieces of art. So what is the aim of Project MeHeLP? Now, we wanted to reconstruct user, carer, and community knowledge and ability around mental health to understand and empower them. And by doing so, by using a participatory kind of co-research methodology, what we wanted to do was we wanted to share the ownership of the problem in such a way that it was kind of equal between the researcher and the researched, and the distance between the two was reduced. And how are we going to use participatory methodology, and what were we going to use it for? We were going to use it to evaluate mental health literacy in the state of Kerala. And theatre and storytelling was used as methodological approaches, and these were used at every step of the process. So it wasn't just, use it at the end of the research process. No, we used it from the start. We used it in participant engagement, we used it in data collection, and we also used it in dissemination. And it was also used as an intervention to promote mental health literacy. And here theatre was being conducted directly with the affected persons being the service users, caregivers, and their families. So why did we choose theatre? Now, as you know, there are all kinds of creative arts. You have music, we have, art. But we use theatre because, as our very esteemed speakers, they spoke about how the playwright veers towards a common objective of deconstructing the experience of mental illness. They have this power to kind of look at mental illness through multiple viewpoints and also foster a kind of critical awareness and engage to envision new possibilities, which is what Project MeHeLP is all about, envisioning new possibilities. Now, what does it do and how do they do that? So theater helps solicit and sharing the insider's views and experience. The insider being the service user and their family. And it also helps in kind of developing a social awareness around mental health. And that could help combat stigma around it. And it could also talk about specific illnesses, be it depression, anxiety, or suicidal behaviors. Now, what happens to what are the audience who's actually viewing theater? Now, an audience can observe the interpersonal dynamics associated with mental illness from a safe position, and in a way, kind of vicariously understand mental health, step into the shoes of the performer or character, despite not having any direct experience. Now, theatre for mental health research can take different forms. We kind of used two distinct forms. We use non-theatrical performances, including storytelling, which Aarcha and Anagha will talk about, and I will be talking about the ethno-dramatic performance. Ethno-drama is a kind of research-based performance where we will be using interview transcripts or field notes to make theatre. So now coming to the planning for the clinic plays. So as everybody spoke about, we were planning for clinic plays across the state of Kerala. Now we were looking at 8 sites: urban, rural, and tribal. And we were looking at 3 different sets of people. We were looking at service users, carers, and community members. So we wanted to have very small, intimate performances in a clinic setting, in and around the clinic, so that service users and caregivers could come and share their stories. So we wanted to kind of create a safe space for them where they could come and share their stories. It was interactive. It was based on their lived experiences. So this wasn't a very small endeavor. We needed to plan, and we planned way well ahead of the process. So what did we actually do? So we had to understand what theatre looked like in these different places. So we had one in Malappuram, so that's a place in North Kerala, and we had something in Ernakulam. So we had to understand what theatre looked like in these different places. And again, we also had to send the theatre experts narrative extracts, and we also send them photos and artifacts. An example of an artifact would be, or a photo would be a photo we sent. We had gone for a home visit to a place in Malappuram, and when we went to a service user's home, she kind of emptied a bag of prescriptions, and we took a photo of that and sent it to the theatre team. So that kind of acted as an artifact, an example of it. And the next thing would be the performance sites. So the theatre director, Chandradasan, he came with us. We went to all the sites, and he kind of had an idea of what different sites look like, what would work in these sites when they would actually come and perform, and also to kind of understand the context-specific metaphors. What is anxiety? What is the term? What is the right term in Malappuram, say, or what is the right term in Attapadi? And as was mentioned over and over again, what is most important in theatre is a trust-building process. They have to let us in. We wanted to create a safe space. So in order to create a safe space, they had to let us in. So it was very important to kind of build community relations with everybody, from the clinic supervisors to the people around. So it was very important to do that. So after this very, exciting process of community building and interviewing, we started collaborating with the research team. Like, we went to the theatre center, and we had these sessions of rehearsals. So as you can see, it was a very interactive session, and we were learning a lot from them. It wasn't just a one-way process. We were learning so much. Sometimes we got overwhelmed by the theatre that we were learning, and we were also kind of helping them. There was a kind of mental health education that was happening with the actors and the directors, and together we scripted co-creative pieces, and it took around 2 months to do so. And after this process of creating scripts based on sites, we had a basic template which we kind of modified depending on where we were doing the plays. And after all of that, we were ready. We were ready to go to the different sites and perform. So 8 distinct participatory performances took place in all our different sites, and we traveled one site after the other. It was like it took place in around 2 weeks. It took 2 weeks, and we completed these performances. So while the performers were doing their magic, we had to time, we kind of stood back, we took photos, we took notes, we were observing them, we were having these small discussions with, different stakeholders. We kind of wanted to understand how they felt and what they kind of understood what was happening on stage. Did they kind of connect with what was happening? And also, after the discussions had, the post-performance discussions happened, and that was when, the research team kind of spoke to everyone individually. And we got a few themes that emerged from these post-performance discussions were the kind of rampant alcoholism and drug abuse which were found in some of these sites, and the spousal abuse that was present, and there was also this, the changing societal values kind of troubled many of the urban attendees. And there was also talk of the magical religious rituals, the traditional healers. That was often the first resort, and they were often fleeced by these healers, and so they had a lot of complaints. And then they talked about how medication saved them, but then they also said that there were so many side effects that it kind of affected their lives. So this, and in the end, in the Athapati context, they also spoke about how medication was actually helping them, but they needed more help. So to conclude with the theatre bit, we can say that theatre, it emerged a very powerful tool, and it was useful in uptake and translation. And that's because of the credible performances by a wonderful theatre team. And there was this constant engagement with the audience, and we couldn't have done it without them. And this can also be, since we did it in so many different parts of in different parts of the state, I think this can be translated to different parts of the country as well. And it also helped in, it corroborated our research findings, and the audience recognized themselves in the play, and it enriched the research findings, and it kind of brought everyone together. And multiple stakeholders, the service users, the caregivers, the community members, the doctors, the theatre members, we all explored mental health together as an issue of social justice and inequality. And when I talk about impact, there was post-performance impact, because even 3 months post-performance, many of the supervisors felt that there was an increased adherence to treatment post-performance. So with that, I pass the stage to Ms. Anagha.
We can't hear you.
Sorry, I was on mute. Good evening, everyone. So all the previous speakers have explained in detail how we have been using the creative and participatory methodologies to engage with communities to have a better understanding of their lived experiences of mental health, illness, stigma, isolation, discrimination, resilience, and recovery, and many more have been. And Sanjana explained how effective the medium of theatre has been in communicating with the communities. And let me have a few words on how digital stories have been used by MeHeLP India team to connect to the people. So before moving on to the process, I would like to have a few words on digital storytelling. So all the speakers like Professor Michael Wilson and Andy have explained the power of theatre and the power of storytelling, and they have raised important questions. How can we connect to a person without knowing their story, and who has got the power to say story? And all these things led us to the creative methodology and innovative ways, like that is digital storytelling. And what is a digital story? We are living in a digital era. There is no need to explain what is it. Still, for those who are hearing the term for the first time, I can say when the oral tradition of storytelling is combined with the visual and sound capabilities of digital media, that is what a digital story is. And what is special about them? Why did we choose digital stories as a medium of communication or a method of engagement with the communities? Because the stories shared in a digital context capture and contain various multimedia elements like animated illustrations, voiceover narration, and music. And why is this important? All these come together with a compelling narrative. Why is that important? Here, we are not dealing with a theory. We are not teaching someone some theory. We are dealing with human experience. And we were clear from the very beginning that it has to be conveyed in such a way that it can generate the emotions of empathy and compassion in the viewer. And we were also sure about the fact that it will somehow help in having better understanding of mental health literacy, and it will eventually lead to the process of eradication of stigma that is rampant in our society. Let me move on to the process. This is almost similar to that of the theatre. We have conducted interviews across 8 sites in Kerala. And based on that, we have done a script, and the team was led by Dr. Melania Warwick and Professor Michael Wilson in this regard. And then we have done subtitles, and these scripts were the voiceover narration for the stories were given by the theatre practitioners. Then we have with the English subtitles for the non-Malayali speakers to understand. Then we have been circulating here via the social media with the mental health literacy questionnaire to have a better understanding of what people think of mental health, what are their understanding of living with mental illness have been, or what is their experience of being a caregiver or being a community member. That's what we have been exploring, and this is what the process is. And I would like to go through the names of the digital stories we have done. We have done 6 digital stories, and each of them deal with different aspects of mental health, lived experiences of mental health. It's as Andy said, we are not manipulating something. This is not imagination. This is taken from the lived experience, and this is purely based on the field notes and interview transcripts. So the interviews digital stories we have done include 6 of them are there: overcoming fear, a zest for life, alcohol and mental health, after marriage, rethinking mental health, and colorful snakes. And all of them are made available in our YouTube channel, MeHeLP India, and also there in our website, mehelp.in. I request you all to go and watch it, because it is something that intended to be the voice of the voiceless. We are trying to communicate, we are trying to convey the voices of those who have been unheard for long. And I would also suggest you all to go watch and think how these methodologies, whether it is theatre, digital story, or short film, can be incorporated as a method of research in other disciplines as well. Thank you.
Thank you, Anagha. Yeah, thank you, ma'am. Now I will be talking about the short films which we had done as part of the project. Those short films were not in our actual plan. Due to the current corona situation, it was not practical to take the theatre plays to the community and do the performances. So we had to go for a plan B, which were the short films. Now, as part of of our research, we had made 18 short films based on our research works in rural, tribal, and urban Kerala. And we had 4 directors, including Dr. Chandradasan. We had 4 directors who had approached these films in 4 different ways. Now, coming to the process of making the short films, as Sanjana has already mentioned, we had taken in-depth narrative interviews with mental health service users, their family members, and the community members. So that was a very long process, after which we analyzed the interviews, and we came up with various themes and various topics which had to be considered while making the film. Now, based on these things, Andy had came up with 10 storylines which talked about various mental aspects related to mental. Now, the short filmmakers in Kerala adapted these storylines to make it acceptable in the Kerala culture, and they formatted the script. Now, another important process of this making was reviewing the script. So the research team as well as the artists sat together, and we had discussions over a period of time so that we make sure that the script is authentic. It didn't give any misinformation, and it was done with due respect to all mental health people. And finally, we came up with the short film. Now, Andy's storylines, what he passionately calls as different paths, covered these areas. One is adolescent mental health, the emotional issues an adolescent face and role of parenting in it. Then tribal and rural perspectives on mental health, their beliefs, their attitude towards mental health. Then we have a short film which talks about the work-life stress and mental health again. Then the stigma faced by the mental health professionals. We also talk about the mental health of the sexual minorities, women's mental health, caregiver burden, and role of social and family support. And stigma has been an element in most of these films. And all of these together, what we try to bring out is the mental health literacy components, which are the knowledge and beliefs about risk factors and causes of mental health, self-help interventions available, professional help available, and how to seek mental health information. And finally, the attitudes which facilitate recognition and appropriate health seeking. Now, another set of 8 films. In that, what we try to communicate is the social and economic factors related to mental health. It is not directly connected with mental illness, but then general well-being and general mental health of the community. So, few areas which we are talking about in these films are the financial issues, how it affects your mental health, then having an alcoholic family member, domestic violence and other issues related to that, then mental health issues of LGBT community, their confusions related to their sexual identity and crisis over they face over a period of time, then issues related to interreligion marriage, pandemic as one of the major reasons for mental health issues, and especially how it affects our children during these days. Then old age and what they go through during old age, the isolation they face, and the mental issues followed after the loss of loved ones. Then stigma again. So these are the movies which we are the topics which we try to communicate. Now concluding all these artistic approach, what we had tried to do is to co-create artistic pieces by engaging with the community members, taking stories from them. We engage with the artists to provide the to make the art pieces, and then we are trying to educate the community with ultimate aim of mental health promotion. Thank you so much.
Thank you, Aarcha, Sanjana, and Anagha. Really interesting and stimulating, content, which also has stimulated some questions which are in the Q&A. And each of you, like starting from Andy, talking about the theater methodology, strengths, challenges in the field, and moving on to Mike, who spoke about storytelling, strengths, strategies, and moving to Chandradasan and the research team, Sanjana, Aarcha, and Anagha, how you presented how it transformed in the field and what you have witnessed over the span of the entire data collection phase and what are the deliverables. Interestingly laid out content, and we have certain questions on the Q&A, and I would read some of it. One question from Tejasi Pense. It is observed that any kind of arts-based methodology would by their nature elicit the therapeutic responses when performed in the communities. Could you please elaborate on how can one distinguish whether it's being used as a therapeutic tool or as a research tool? So who would take this question?
I could say something very quickly. It might not be a full answer, but my response to that would be that I would never claim that the work that we're doing is therapeutic, and that's because I'm not a therapist. That's not to say that it wouldn't have a therapeutic consequence, and other people might themselves identify therapeutic benefits from that work. But I would be more likely to say it is a research context here, but also a social and cultural act as well. And I don't think those different things are mutually exclusive. I don't think it has to be one thing or the other. It can be all of those things at the same time. That was my answer anyway.
Thank you, Mike. And certain time, I mean, it depends. Therapy is part of it, but it's not like mandated. But people can realize the need for therapy and take a first step So that also is therapeutic in nature, that I realize that I need to go for a long-term intervention. So that's how even I see that. And the next question is by Radhika Mohan. My story, what I am telling today at this moment may be true to the context I am in now. So isn't it that all stories told are true? So
Depends what you mean by truth, of course. Truth can mean many different things. And there is the truth and a truth, and there is truthfulness, and all of those things may be slightly different. The easiest way I can answer it is by telling you a story, but I don't think I have time to do that now.
Can I just add, and it
Yes,
connects
yes.
to what we were just saying, that the difference between therapy perhaps and the research language is it's trying to open up a conversation in which lots of stories are being shared. So people are revealing themselves. So it is absolutely a social act. Now, of course, in the revealing of your story, you may get a therapeutic response to that. But in a way, this question about truths is that it's not necessarily we're looking for this truth, that truth, the other truth, but it's in this collection of truths, collection of stories, collection of voices that you begin to navigate and see different ways of understanding things. So in a way, yeah, any story can be told, but when you put them all together, you start to notice patterns and differences and what connects them and what's different from them and what are the themes that come out of them, whether they're truthful or not. So yeah, that's just a little response to those two things.
I'll just add that the term truth itself is a very flimsy term. What is absolute truth and how much truth is truth itself? So
Yeah.
we are now living in a post-truth time. We say that it's a post-truth era where things happening. So the thing is that when somebody is telling her story or his story, so the layers of truth is the question. So when somebody tells the story, we share some layer, some outer layer of it. So how deep you can go, how many layers you can dig into is the question. So that happens when theater is involved. That's our experience. So it's not about the absoluteness of the truth or the truth of the truth, but it's about the feel of the truth. How I understand truth today. For example, for somebody who say that no, I saw a golden snake just flying over my head right now. It's a truth for me, but it's not a truth for the others because I have felt it, I sensed it. So when it comes to such situations, we should have a kind of open approach to the term truth and to the authenticity, etc., and to understand it in a more human uh, uh, situation and go into our kind of readings about it. So that's what I feel.
Um, how can theater be used with people who are uncomfortable expressing their emotion, showcasing their body language, or are uncomfortable around people? Will it not become counterproductive?
Sure.
And
Yeah, complete.
and connected to this, there is one more question as well. Someone has asked, has there been any person with lived experiences who was part of the theater performances? These are two questions you could take as the last.
See, in this first sector of performances which we have been speaking, so we have decided that that happens in a very comfortable space for the people who are undergoing this process. We had around 50 people only to have an intimate experience, and most of the people, at least some 20 to 30 of them, are people who have either taken treatment or had treatment before, overcome the problem, and then the rest was caretakers, their family members, and the doctors, and there was no public, none of them who come to know what is happening there, as in the case of. So it's only between people who are uh, the stockholders, the real people, and yeah, and you
Yeah,
want to.
yeah, just to add that yes, they did participate in that, although they weren't part of the main show. When we got to the end of the storyline, the characters who were facing particular issues and their family members asked the audience, What do we do to get through this? So they participated by suggesting strategies to allow the characters and their families to move forward. And then around that, there were elements within the performances where the audiences joined in doing things. And at the end of the performance, sometimes they would come onto the stage, and with the performers, they would dance or sing or whatever it would be. So there was participation with people with lived experience.
I think we are coming to the end of this session. If anyone wants to respond, add further.
I was just going to say, I think one of the important questions here is around what happens with somebody who is perhaps a reluctant storyteller or a reluctant participant, and it's very common. I mean, one of the initial things we often find working with groups is people will say, "I don't have a story to tell," by which they mean, I don't want to tell a story, or I don't have a story I want to tell at the moment. And it's part of our responsibility to try and create a safe and trustful space in which stories can be shared, and a supportive space, and people feel able to. But there's no problem if people don't want to share a story. No one's compelled to do so. But we hope that people will, and most people will at the end of the day. But it's also, I mean, we're here talking about and advocating for theatre and storytelling and so forth as a methodology. But let's not pretend that this is easy work. It's not. It's really, really hard, really difficult. It takes time. It takes resources, and sometimes it doesn't work. It doesn't work so well. So, you know, it's like any form of research, and certainly any form of arts-based work. There's always some element of risk about success or failure in it, which is what ultimately makes it worth doing.
Thank you, Professor Mike. And yes, it's really effective, but at the same time challenging. Thank you, panelists. It was a wonderful panel. Lot of interesting insights and also highlighting challenges. And also being part of the team, I have seen how creative and participatory methodologies work as an effective method while engaging with the most sensitive population, because power, agency, are they underrepresented? Where are users? These are several questions that are going on in the mental health sector. And this particular methodology have really proved efficient in building agency, listening to their stories, bringing their voices to the platform. So with this, we conclude this panel. And thank you all the panelists, Andy, Mike, Chandradasan, Sanjana, Aarcha, and Anagha for your inputs. Thank you so much.
Thank you so
And
much.
yeah.